1039 WDKX, the Wake Up Club. This half hour, the Wake Up Club, being brought to you by Jordan Health. You can log on to the website, jordanhealth.org, and get all the information you may need, jordanhealth.org. And as always, on a Wednesday house call is Dr. Janice Harbin. Good morning, Dr. Harbin. How are you?
Good morning. Good morning. I'm well. Good morning, Rochester.
Always good to hear you when it comes to medical information. You know, you're the first to go to at Jordan Health. If you need medical assistance, 423-5800, 423-5800. Dr. Harbin, we just got off the phone with Monroe County Executive Adam Bello, and he basically said what you've been saying for the last few weeks or so. There just isn't enough vaccines for everybody right now.
That is absolutely the truth. We never know exactly how much is going to come to the area. We were very fortunate to partner with Monroe County, and Adam was gracious enough to get us 440 doses so that we could start vaccinating our senior population that we see at Jordan Health.
All right, so we're looking at what numbers now? Obviously, we're looking at anybody who's at the age of about 65 or older that you could service, but you need more of the vaccine. So until we get more of it, what are we supposed to do in the meantime?
I would say we still have to follow protocol and recommendations. We need to wear a mask. We need to social distance. We need to stay out of each other's homes if they're not living there. And like I say every week, I'm a big mama. Stay out of Big Mama's house. You know, give her a break, give him a break to make sure that we're not exposing them, because it's going to be a while before we can vaccinate everyone that really needs to be vaccinated.
I also have to ask, you know, if there's more on the way, would people have to call Jordan Health? Can you make an appointment for the vaccine? How does that sort of work if you're trying to get in touch with Jordan Health?
You cannot call for appointment for the vaccine. Like you said, we do have a hotline, but that hotline is for the testing. And if you're having problems for the vaccine, we are reaching out to patients of record. We have nearly 5,000 patients at Jordan Health that's over 65 and older. So we have been calling them, scheduling. We have had great reception from them coming out. Yesterday was our third clinic. We have another one today, but you cannot call for the vaccine.
Okay. All right. So just understand that. But if they need other medical services, 423-5800.
Yes, that's correct.
That's the number for Jordan Health. Dr. Janice Harbin joins us now here on the show going forward. For those that have gotten the vaccine, there's also the second dose. That's been scheduled already for people who have gotten the first one?
Yes, the second dose have. So when you come in, and I worked the clinic on Saturday, we had a great turnout. They were scheduled with their second appointment 28 days from the first. So I will have mine next week, will be my 28 days. Next Wednesday, I get mine. So they will get an appointment. We follow up. The state, those come automatic. So we enter the information into the computers, into the state computers, and they will send out 28 days from when they send you the first dose, they will send you automatically the second dose.
Dr. Harbin, I have a question from the frontliner. A frontliner wants to know, with these vaccinations, can you mix the vaccinations? Meaning, if you get a Moderna shot for the first shot, would you be able to go with the Pfizer shot for the second shot?
No, that is not. So if you start with Pfizer, the second dose will be Pfizer. If you start off with Moderna, the second dose will be Moderna. I mean, the good news about the Johnson & Johnson vaccine is they're saying that is a one-dose vaccine. So that would really be a game changer when that is finally out, because we only have to worry about giving you the one dose. But they will not mix it, and they should not mix it.
We're talking with Dr. Janice Harbin, who is running things over at Jordan Health, 423-5800 if you need services or at least have a question, 423-580-5800. Before we go, Dr. Harbin, you know, Adam Bello brought up something I had not really heard of before. The possibility of more than just these two vaccines, Moderna and Pfizer's vaccine, and that Johnson and Johnson's working on one. He mentioned another one I can't remember off the top of my head.
AstraZeneca also has a vaccine. I think they're using that vaccine in Europe right now, and so that's another one that should be coming to United States very soon. I think they approved it in Europe. They had not approved it yet here. But hopefully soon that would also be by early spring. It will be here in the United States, which will increase the supply.
Thank goodness you know, because I swear to goodness, the guy just told me like 20 minutes ago and I forgot. That just goes to know you that Dr. Harbin.
We are living and breathing COVID and COVID testing and COVID vaccines. For me to be a tooth doctor, it seems like I'm living and breathing COVID. So a lot of meetings, a lot of discussions, which is good. That means that a lot of discussions, a lot of research, a lot of information being shared so that we are on top of what we're doing and knowing that when we actually get that vaccine, we have the studies and the history behind it.
That's why we trust you, Dr. Harbin. You and everybody else at Jordan Health, 423-5800 for the Wednesday morning house call. Thank you, Dr. Harbin, for the time. We appreciate it.
Thank you. You guys take care, stay safe, stay well, and stay masked.
That's right. Well, 103.9 WDKX.